Good afternoon. I'm Jim Carmen, Vice President of Council, Chapter, and Member Support at the Military Officers Association of America. Welcome to MOA's continuing series of webinars. Today's event is an interactive discussion of your TRICARE benefits through two major life transitions, at retirement and upon turning 65 years old. Today's webinar will be recorded, and those registered will receive a link to a recording of this event within a couple of days. MOA will then post this recording to our website within about 2 weeks for access by our paid members. As a reminder, you can submit your questions via the chat function, and we will answer as many as possible during the Q&A portion of today's webinar. To assist MOA with continuous improvement efforts, please take a couple minutes at the conclusion of today's session to complete the short survey. As many of you know, MOA's primary mission is legislative advocacy, and some of our top priorities for 2019 are listed on this slide. And of course, in our advocacy work, we represent the needs of all 7 uniformed services. MOA stands strong to represent the interests of the entire military community before Congress and the executive branch. But we need your help, and we invite you to join MOA to support this important work. The MOA Foundation, a 501c3 charitable foundation, was created to help military families meet these unique challenges of lifelong career development as they progress through their military careers. Through events and activities like this webinar today, the MOA Foundation annually impacts the lives of over 50,000 military families. You can find more information on the foundation, its important military family scholarship program, and make a donation at moa.org/donate as listed on the slide. MOA's career transition programs rival anything available in the private sector. We deliver trusted and focused decision support to assist service members and their families with all of life's major transitions. Here is our upcoming events calendar, all of which are open to the broader military, veteran, military family, and survivor community. Also, we would like to cordially invite each of you to mark your calendars for the 2019 MOA Military and Veteran Networking Forum and Hiring event to be held on Thursday, September 19th at the Smithsonian Air and Space Museum in downtown DC. You won't want to miss one of the most unique opportunities to meet senior executives, hiring managers, and entrepreneurs at this very professional venue held in the evening after the normal workday. You can find information on these programs and more at the website link at the bottom of this slide. As I reviews the slide deck for today's webinar, I recalled my transition off of active duty after 25 years as a Navy pilot and my second major healthcare transition to Medicare as my wife and I turned 65 recently. There are many opportunities to miss a critical decision point in both of these transitions, and a mistake can be very costly. I encourage you to learn the facts, and today's presenters are just the best in the business. Both are credentialed financial professionals, and I'm honored to work with them. With that as a short overview, let me introduce Shane Ostrom and Paul Frost, and Paul is our first speaker today.
Thanks, Jim. Good afternoon, good evening, good morning for wherever you're located. We're happy that you could join us today. Here's my topics. I'm going to do TRICARE for retirees, and Shane will do transitioning into Medicare and TRICARE for life. Why we put together the TRICARE for retirees brief is we, through our local presentations in the National Capital Region, we realized that many retirees depended on their spouse to run TRICARE for their family. And so while most spouses are very knowledgeable on the TRICARE system, they don't necessarily know the changes once you transition from active duty or reserve duty to retirement. And certainly many of the active duty or reservists didn't know the issues for their family. So that is why we put together this brief. So here's a list of the agenda for today for TRICARE retiree benefits and what we're going to cover. So I'm going to go ahead and talk about the regions. In 2018, we went from from 3 regions to 2 regions in the United States. So that's the West region. So for those of you west of the Mississippi and in Texas, Oklahoma, Arkansas, and Louisiana, you're in the East. Everybody else out west is in the West region. So Humana Military manages the contract for TRICARE in the East and Health Net Federal Services in the West. So as you're transitioning, you don't contact TRICARE, you're going to contact the contractor to set up which TRICARE program you're going to enroll in for you and your family in retirement. If you decide you're going to live overseas, there is a separate contractor for the overseas locations. That's International SOS. And the overseas regions are also broken down into 3 regions, Latin America and Canada, Eurasia and Africa, and the Pacific region. So you can see how to contact those contractors to set up for what we will talk about TRICARE Select Overseas in more detail a little bit later. So let's talk about the 2 major programs that you can choose from for living in the United States. That's TRICARE Prime and TRICARE Select. TRICARE Select is the new terminology for the old TRICARE Standard that changed to Select in 2018. We're going to talk Prime first. And the first thing we need to do is talk about the 2 different groups that we got divided into starting in 2018. Those who were in service prior to January 1st of 2018 are in Group A. Those who came into service after January 1st of 2018 are in Group B. So those of you who are retirees are going to be in Group A. TRICARE Prime is like a health maintenance organization. The Defense Health Agency owns the military treatment facilities and hospitals or the TRICARE Prime networks. And you have to go through the insurer or the Defense Health Agency to get your TRICARE Prime. So they own the doctors and they tell you who you can go and see. There are fewer out-of-pocket costs with TRICARE Prime than TRICARE Select, but you have less freedom of choice. You have to go through your primary care manager, which I'll explain in the next slide, but you have to go through that manager, that doctor or physician to get any referrals out into service. So retirees can remain or choose TRICARE Prime. So if you were in Prime while you were in service, you can stay on Prime, but you actually have to actively call TRICARE, one of the contractors, and request to stay on Prime. If you are located in a Prime service area, meaning especially for those of us here in the National Capital Region, we have many military treatment facilities, so you have plenty of options. It doesn't mean that that particular military treatment facility is going to have an opening for a retiree, but you have to call and ask, and you can ask them, this is the primary location I would like to be seen at, or I would like my family to be seen at, and they will tell you if they have openings for you. If you are in a metropolitan area, typically it's metropolitan areas that doesn't have a military treatment facility, TRICARE may have set up a Prime service area or Prime treatment facilities in that area, and so you can be seen under Prime in those locations, and it's typically a Humana or type of hospital or clinic facility, and typically you have to be within 100 miles of that military treatment facility or that Prime service area to be able to be enrolled. If you are seen in the military treatment facility, there are no costs associated with any care inside of it other than your enrollment costs, which I'll get to. If you're seen at a TRICARE facility that's not a military treatment facility, there are some copays, and we'll cover those. I'm at the bottom block there, just as a reference. We talk to folks all the time about how much healthcare costs in the civilian world. Now, our retiree healthcare, our active duty healthcare, and comparing to civilian care is apples and oranges. But just to have an understanding of what healthcare costs out on the open market, it costs an employer about almost $20,000 a year for a family plan, and most employees are going to pick up about 29%. These are the 2018 averages. For a single plan, it's almost $7,000, and the employee picks up about $1,100, and that's just the enrollment or the premium cost. It doesn't necessarily cover any co-pays or what the catastrophic cap would be for those plans. So that's just a reference material, and I won't bring that up anymore. We'll just strictly talk about our TRICARE plans. So you can enroll 3 ways. You can go online, you can call the regional contractor, or you can send in the mail, snail mail if you like. They'll assign you a primary care manager. Typically, if you're going to do this online, you get your choice, and they'll show you who's available if you're available to join that military treatment facility or that network, and they'll show you which type of doctor. So if you're interested in a male doctor or a female doctor, or a specific type of professional to be your primary care manager, they'll show you who is available, and you can pick that person. That person then becomes solely responsible for scheduling all your routine, non-emergency, and urgent health care needs. And you must go to them to get a referral. Otherwise, you're going to be under what's POS, which is called point of service, which I'll explain in a few slides, which is going to cost you more out of pocket. For TRICARE Prime, there are enrollment fees. Currently for 2019, for an individual, it's $297 annually, and for a family, it's $594. That has been COLA adjusted, so these went up a little bit this year. It was actually right at about the 2.8% COLA amount, and they are scheduled to go up by that amount each year. They will be prorated from the enrollment date. So if you retire on June 30th of a year, and these are based on calendar years now, starting in 2018, they switched from a fiscal year to a calendar year. They're prorated. So if you retire on June 30th, you're only going to pay the enrollment for 6 months, not the full 12 months. You can pay it 3 ways, as you see there, either debit, credit, or a transfer from your bank, electronic fund transfer, and then you can pay it via monthly, quarterly, or annually. That link there, the tricare.mil/costs, that is where you can, under each particular plan, they will detail the cost for all the individual services. And I've got a few of them on the next slide. I just want to point out that for the enrollment fees for surviving spouses of an active duty death or a medically retired veteran, their annual fee becomes fixed for whatever the cost was in the year that either the active duty service member passed away or the medically retired veteran was medically retired. So whatever the fee was during that year, that calendar year, that's the fee that will remain for them for the remainder of their lives, unless they switch plans. But for Prime, it will remain Prime. Co-payments. So if you are in a Prime network outside of an MTF, you will have charges. You pay no charges if you're seen inside the MTF, military treatment facilities, MTF. Outside, though, if you get either for primary care or for specialty visits, you can see it used to be based on a percentage, and now they've gone to a fixed cost. So you can see urgent costs, emergency services, labs and x-rays don't cost you anything, but if you need ambulance services, that can be $41, and you'll see the select costs in later slides. Their catastrophic cap, when you change from active duty to retiree, increases from $1,000 to $3,000, and then starting in 2021, it goes up to $3,500. And then COLA thereafter, so $3,000 a year. So in the year of retirement, say again, that example that you're retiring on June 30th, and you've already, your catastrophic cap on active duty was $1,000. Say if you had already spent $700 towards your cap, that $700 on July 1st would roll over and you would only have $2,300, not the full $3,000 left for your catastrophic cap. The enrollment fees for TRICARE Prime do not count against the cap, and the cap cover applies to all covered services. So if you go and have something that's not covered under the cap. I mentioned POS, point of service. A lot of folks get sometimes frustrated if they need a referral service and they don't want to wait a long time to be seen. They'll go out and find somebody to take care of whatever need it is. That's called point of service. You don't have to get a referral, but your out-of-pocket costs are going to be significantly greater. The fees don't apply to your catastrophic cap, and you have deductibles that you don't have under Prime, but if you go outside of the Prime network or outside of your PCM's referral system, you do have these deductibles, $300 for an individual and $600 for a family. And the copay can be a lot higher than the TRICARE allowable charge, up to 50%. So if you want the freedom of going to outside of the network under TRICARE Prime, you just know you're going to pay more for it. TRICARE Select, again, we have Group A and Group B. We consider this a preferred provider organization, or PPO. So you have a network of doctors that are accepting the TRICARE insurance, and you have the freedom to go to any of the doctors that are inside the network. So you want to go and find somebody that accepts TRICARE, and you'll be covered up to the points of your deductibles, which we'll talk about, and your copays. So your enrollment fees begin on January 1st. This is something new. Right now, TRICARE Select for the next year, or excuse me, through 19 through 20, for the next 2 years, there are no enrollment fees, but starting in 2021, there will be an enrollment fee just like TRICARE Prime. It'll be $300 for family and $150 for individuals. This will be increased by COLA each year after starting in 2022. There's no fee for medical retirees or active duty spouses. And you can pay the same way as you did for TRICARE Prime, either annually, quarterly, or monthly. Now, you may have a issue. I want to know, how do I know which doctor accepts TRICARE Prime, or excuse me, TRICARE Select? I'm sorry, we're having some technical things we're trying to fix. Okay, so there is this wizard. It's called the Find a Doctor wizard. So you can see it there. You go to that link, and it takes you to this page on the TRICARE website. All you need to do is enter your zip code, and it will tell you how far away they are, but within about a 25-mile range, and you can adjust how far away you want to see who takes TRICARE Select. So it also uses the same wizard for overseas, and I'll show you how to do that in a few slides. So the doctor wizard will tell you who in that area will take your TRICARE Select. There is an annual deductible. So besides the enrollment fee starting in 2021, you will immediately have a deductible that what you must pay prior to TRICARE picking up any fees. For family, that's $300 and $150 for individuals. So the initial out-of-pocket cost for you is going to be that $300. Then you're going to have co-pays. So the first $300 is for you, and then after that, you're going to have co-pays, and that's the maximum that TRICARE acceptance. A physician will accept what TRICARE says they can charge, and then you will have TRICARE will pay that amount, and then you will pick up the copay, or it's called copay or co-insurance fees. And you can see here they are for outpatient, visit, specialty. So you can see they're a little bit higher than Prime. Emergency services, $41 versus $111. Okay, so Select has more choice, but again, some higher costs, although the catastrophic cap is the same as TRICARE Prime. So it increases to $3,000. $3,500 in 2021, but it's higher than the $1,000, and the same rules. Now, if you go outside of the network for TRICARE Select, the non-network fees can be up to 25% of the allowable, and the allowable can be up to 15% more than your TRICARE allowable charge. Okay? Let's move on to retired reserve. We get a lot of reservists who tune in, and we didn't want to leave you out. I'm not going to cover TRICARE Reserve Select. I'm assuming all of you are in transition, so you have the option now, once you're in retirement, non-regular retirement, of selecting TRICARE Retired Reserve. This is a premium-based plan. It is very expensive, as you'll see in a few slides. It's available worldwide, and it's for qualified selected reserve members and their families. Who would that be? That would be retired reserve members who are under age 60, because at age 60, you get 5 years of TRICARE coverage, but you have to be qualified for non-regular retirement under the federal code and are not eligible for enrolled in the Federal Employee Health Benefit Program, FEHB. Your family members of qualified reserve members also may participate, and survivors of retired members if the sponsor was covered by TRICARE Retired Reserve at their death or eligible prior to age 60, and the survivor also must not be eligible for Federal Employee Health Benefit package. You can enroll the same ways, online or by phone or in person. Actually, it's not by mail, so that's the one difference. And through the beneficiary enrollment application, you can contract the regional contractors or visit a TRICARE service center. Enrollment, here are the costs. So, and this is monthly, $450 per person, or almost $1,100, $1,083.40 for a family. There is a deductible for each. So family, it's $300 if you're in network. It goes up to double that, $616 outside of network. And you can see the individual $154 and $308. And those are basically cost-based schedules. The catastrophic cap is almost $3,600. However, the pharmacy is the same as Prime and Select, and I'm going to get to those. So if you're in TRICARE, if you select TRICARE Retired Reserve, the pharmacy payment schedule is the same for you. So that's TRICARE Retired Reserve. If your children are under TRICARE, they will age out at 21 or 23 if they're in college age. If they still go to school after 23, or if they are in an internship, or if they're at a small nonprofit, or if they're at some place where they're employed or even unemployed and don't have health care coverage, you can get them coverage up to age 26. But they must remain unmarried and can't have reached 26 years old. At 26, they would age out and not otherwise eligible for TRICARE coverage, because if they were eligible, you wouldn't need TRICARE Young Adult. There are the two versions, Prime and Select. Prime works the same as TRICARE Prime, must be in a Prime service area, and they must have a PCM with monthly premiums of $358 a month. You can see those costs at the same TRICARE.milcost website. You can also select TRICARE Young Adult Select. That's a bit cheaper, so $214 a month, but there are the deductibles and the co-pays. Now, under the Prime Young Adult, if you are not seen at a military treatment facility, there will be co-pays with that as well. And these will be under Group B. So it doesn't matter if you're in Group A, anyone in TRICARE Young Adult will be in Group B. Okay, TRICARE Young Adult. Those of you who live in 6 regional parts of the country have the option of U.S. Family Health Plan. I'll show you where those are located in a future slide. This is a TRICARE Prime option that many people have heard of. You will have instead of a PCM, you'll have a PCP, primary care provider. It gives you everything that TRICARE Prime gives you, including a pharmacy, and the PCP will provide you with your referrals. The big thing that catches people unsuspecting, if they don't read all the fine print, is that you don't get your pharmacy through any military treatment facility. So this can be a big deal for folks who have significant pharmacy issues, need many drugs or prescriptions, and so you're going to pay through their system, and it's the usual copays, but you can't get them at a military treatment facility for no money. and you can't be seen in a military treatment facility. So if you have an emergency and you're closest to a military hospital, if it's an emergency, most likely they'll take you, but you might get billed for it because you're not supposed to be seen in a military treatment facility under U.S. Family Health Plan. You have the TRICARE prime enrollment fees, and there's no deductible, no annual deductible unless you're under point of service, and then you have the point of service deductible that I showed. Here are the 6 areas that they're located in the Northeast, here in the National Capital Region, Southeast Texas, Western Louisiana, and the Pacific Northwest. For those of you who are deciding to live overseas, you have TRICARE, the option of TRICARE Select Overseas. It's for retired. There is a TRICARE Prime Overseas, but that's only for active duty families. So for retirees and their families, you have TRICARE Select Overseas. You can see there the healthcare plan and what it covers. You can enroll only by phone or mail. There's no online for this program. Now this has a combination of costs. So you have the enrollment fees of Prime, the deductibles of Select, and the copays of Select under B, Group B as well. As I mentioned, you have the same Doctor Wizard. I turn to that page. So instead of entering a zip code, you use the country tab and you select the country, and then it will list the doctors and clinics and hospitals that will take your TRICARE Select Overseas. I advise you that if you're going to a small country, that there may be very limited number of physicians or clinics, hospitals that will take it. And typically what we recommend to those folks who are going to small countries overseas, or even if you're going to a larger country, check with the embassy or the consulate and ask them, where do expats, folks, Americans living overseas, go for care in whatever city or in that country. Here are the pharmacy pays under TRICARE. So again, as of now, under the new program that started in 2018, no costs if you can get all your medicines at the military treatment facility pharmacy, and that's going to be a 90-day supply. For initial prescriptions, if you're not getting it at the MTF, you typically have to go retail, and you're only going to get a 30-day supply. And so you can see the cost there. In 2019, generic is $11. Over the next 8 years, it'll go up by 3.4% a year, up to $16 by 2027. Again, those are a 30-day supply. If then it's a maintenance drug, what we recommend is you then get it through Express Script. If you can't get it at a military treatment facility, you get it through Express Scripts mail order, and that gets you a 90-day for you can see it's either the same or a little bit less than the 30-day. So you certainly want to transition for maintenance drugs to Express Scripts if you can't get it at an MTF. Okay, starting this year, TRICARE Retiree Dental Plan went away, and you now had the option of using the federal employee dental and vision plans, insurance plans. So this was for retirees or family members and survivors. It was available overseas and in the United States. So your transition from for active duty, you're going to transition to this, and then your family starting next year or this year it'll be FedVIP. But if you're transitioning next year, you lose the TDP, TRICARE Dental Plan for your families, and you're going to have to go to the FedVIP plan. This year's open season was November 12th to December 10th. Next year, we believe it's going to be the 11th to the 9th, 11th of November to the 9th, but they haven't announced those officially yet. But then that will be effective for January 1st of 2021. So these dates were for this year. You must be enrolled in a TRICARE plan to be eligible. However, we get asked if the veterans in a VA plan, does the spouse still become eligible for a dental and vision plan? Yes, as long as the spouse is enrolled in TRICARE, then he or she is eligible for FedVIP. I'm not going to go into the shopping. We did a shop for your FedVIP plan back in October, and that's still available on our website, and we'll do another one this year for this year's transition. But there are 2 websites that you can go to find out information about this. The TRICARE Benefits website, which is on your screen now, And that was developed, and doesn't have all the functionality now since they took it down after the open season. But this was designed because the military were going into the new program, and this was based on a new federal program. This was based on and had language for retirees and active duty folks. The actual website that you use to enroll is the Benefeds website, which you can see here. And this has more federal employee language. So we're not sure yet whether they're going to bring back up the TRICARE Benefeds site again during this next open season, or whether they will have adjusted this site, the Benefeds website, to make it more user-friendly for military retirees. But either way, once you did your shopping and figured out which plan you wanted, you had to come to the Benefeds website to enroll. At this point, I'll go ahead and transition it over to Shane Ostrom for your transition from TRICARE to TRICARE Medicare and TRICARE for Life.
Okay, good afternoon, evening, good morning. Welcome everybody. Let's talk now about those of you that are coming up on age 65 and you're going to make the big transition to TRICARE for Life. Folks, we have been receiving a ton of questions out there. As Paul was talking, I was trying to answer as many questions as possible. But a lot of those questions had to do with TRICARE for Life, and I'm going to cover most of those things that were being asked. So let's get right to it. First off, we're going to talk a little bit about, in a general sense, the big picture transition. You're going to make the big picture transition to Medicare and TRICARE for Life at age 65, of course, because that is when you sign up for Medicare. Don't get Medicare enrollment at age 65 confused with Social Security, because Social Security and retirement benefit enrollment and Medicare enrollment are two separate and different things. Social Security can be done anytime between age 62 and 70, but here you've got to lock in on the age 65. TRICARE Prime and Select stop after age 64 by law. They no longer are an option for the vast majority of you. There are a few exceptions out there, but we're not going to get into those because they're very rare. But TRICARE for Life starts at age 65 by law. And then TRICARE converts from a major medical plan at age 65 to a Medicare supplement. So all those Medicare supplement solicitations you've been receiving after all this time, just throw them in the garbage. You don't need any of that stuff. Don't listen to the robocalls or anything like that, because you're going to have your Medicare supplement through TRICARE. And I've already mentioned the TRICARE Medicare Social Security connection there. To enroll in Medicare, it's easier to go online, but you can also go to your local Social Security office. You've got a 7-month window to enroll. This is your initial enrollment period. You do not want to miss this. You want to sign up as early as possible. So you get 3 months prior to your birthday month, you get your birthday month, and you get 3 months after your birthday month. If you wait until your birthday month or later, there might be a gap in coverage. You don't want that. Sign up early. Early birds get the worms here. You want to enroll in parts A and B, Alpha and Bravo. Do not enroll in Part D Delta. Part D Delta is the pharmacy plan. You do not need that. We'll get into that here in a little bit. Once you're enrolled, you will get your Medicare card in the mail, your Part A and B Medicare card in the mail, and you're going to use that Medicare card, take it to the ID card section, in the local ID card section, and get your ID card updated. Okay, once we get got you into the ID card section, then you're going to go in there in the ID card section. They're going to update your ID card, and at the same time, they're going to enroll you in the TRICARE DEERS computer system as a TRICARE for Life person, and you will be golden. That's how you get it done. Okay, so next thing is, when we get into, there's also a special enrollment period. So you're going to enroll under the initial enrollment period that I just mentioned to you, the 3 months prior to your birthday month. But if you're working and if you are covered by an employer health care plan as you work, then you can wait to sign up for Medicare until later, and you will not pay a Medicare premium penalty for enrolling late, because you're working and because you're covered by an employer health care plan. If you choose to just be covered by an employee health care plan with your employer, you'll wait and you'll have an 8-month period from either the end of the employment or the end of your coverage, whichever comes first, to sign up for Medicare at that point. Always sign up for Medicare early to ensure that by the time one healthcare plan is finishing, you're already enrolled and ready to move into the next one so you don't have a gap in coverage. Next thing we will get into here are some of your options. Now you say, well, I've already told you you're going to get into Parts A and B Medicare, but there is a bit of an option here for you. Medicare comes in two flavors: Original Medicare, which is Medicare provided by the federal government. So the federal government is your insurance company if you sign up for Original Medicare Parts A and B. You also have the option of signing up for Medicare Advantage Plan, which is also known as Part C Charlie. A Medicare Advantage plan is also Parts A and B Medicare. The difference, though, is instead of being the federal government being your insurer, you're going to be insured by a private commercial insurance company, healthcare provider. So which do you want? You want the federal government to be your insurance company, or do you want a commercial healthcare insurance company being your insurance company? Both count as Parts A and B Medicare. Doesn't matter which one you have. Either one works just the same with TRICARE for Life, so it doesn't really matter. Why would you even consider an Advantage plan? Because sometimes the companies, they want to offer you a choice of how you want to be covered. And then sometimes these Advantage plan companies provide you with additional coverages. And as a result, some people like the additional coverages. Like some people may find that there's coverages out there for gym memberships or massages or chiropractic care or something like that. So maybe you're looking for something like that. Could cost a bit more. If most of these plans, the Part B premium, instead of going to the federal government, just goes to the insurance company. So the Part B premium is your premium for the Advantage plan, but some plans do charge a bit more. So just be aware of that. If you're willing to pay a little bit more to get a little bit more out of it. Mainly because you might prefer a private insurer, but also stay away from the Advantage plans that have Part D built into them, because then you're stuck with the Part D. The reason I've said this now a couple of times about the Part D part is because that is the pharmacy plan. Part D is the pharmacy plan, and if you get the pharmacy plan with some other company, it messes up your TRICARE pharmacy plan. And so you probably don't want another pharmacy plan. Okay, next thing, we'll move on here. Yeah. Now, I've already mentioned TRICARE. As you're enrolled in TRICARE for Life, TRICARE acts as your Medicare supplement, and you must have Parts A and B before you can supplement it with TRICARE. So once you're into the A and B, you'll be good to go. You get your ID card updated and all I've already mentioned. The TRICARE pharmacy plan is the same for everyone, regardless of age and regardless of your TRICARE plan. So it's what you've been accustomed to with TRICARE pharmacy will just continue the same way as you move into TRICARE for Life. And you can still use the base pharmacy if you want to use the base pharmacy. Any family members you have that are less than 65 years old are going to stay on their TRICARE Prime or Select plans until they move into age 65, and then they will go on to TRICARE for Life. Now there are always some exceptions, but if you are if you're receiving Social Security disability payments, once you've been on Social Security disability for 2 years, regardless of your age, you will be moved into Medicare at that point because of your Social Security disability status. And once you're moved into Medicare due to your Social Security disability status, at that time you will become TRICARE for Life. I don't care how old you are at that point. The idea is if you're on Medicare, you're in TRICARE for Life. That's how that one works, just so that you're aware of those exceptions. Okay, I always get the question, because Paul and we get a ton of questions about how much does this Part B cost? Now, Part A Medicare, is free. Okay, it's not free. You paid for it through your payroll taxes. All the years you've been working, you were paying for Part A Medicare. So Part B Medicare, you'd have to pay for, though. Here are the premiums, and they're indexed according to how much money you make. They determine how much money you make by looking at your tax returns from 2 years ago. And that's because that's the latest tax return that's on file. So right now you're in the process in 2019, you're filling out the tax forms for 2018. So that means, so we don't have your 2018 results yet. So as a result, we go back to 2017 to see what your numbers are. And you see here, here's what the premiums are. And for some folks, yeah, they can get a bit healthy on the premium rates. Next one. So if you're already receiving Social Security retirement benefits, then the Part B premium is deducted out of your Social Security. But if you're not receiving Social Security retirement benefits, then you'll set up a payment process during your enrollment. There is no charge for the TRICARE part of TRICARE for Life so far. I mean, I've got to tell you, as I put my lobbying hat on, one of the things we have to fight every year is that DOD and the budget tries to sneak in a fee for the TRICARE for Life piece. Every year we've beat that back. So we're good to go that there's no fee, and there's nothing being discussed this year in legislation to add a fee onto TRICARE for Life. But I just want you folks to be aware it's a continuing battle for that one. Now, as we move to the next thing, let's talk pharmacy real quick. These are the pharmacy rates. And like I said, all pharmacy is the same for everybody who's covered by TRICARE, regardless of what your age is or your TRICARE program. So these pharmacy rates don't change for anybody out there. And you can go to the base pharmacy if they have your particular prescription available. If you're a part of the U.S. Family Healthcare Program, you cannot use the TRICARE pharmacy because you are obligated to use your U.S. Family Healthcare Pharmacy plan. Next one. Okay, there's some open seasons with Medicare. Let's say you go ahead and you enroll during your initial period of time. So your initial enrollment period is what it is based on your 65th birthday. But let's say now you're into Medicare, TRICARE for Life, and at some point you might want to change your Medicare option or your plan. Well, you got to wait for the open season. The open season, if you're in original Medicare, which means you have the federal government as your insurance for Medicare, your open season is October through December. And if you have an Advantage plan with Medicare, so your insurance comes from a private corporation, then your open season is January through March of every year. If you don't want to do anything to change your program, do nothing. Don't even pay attention to the open seasons. But if you want to change anything about your program, like you're in original Medicare, maybe you want to go to an Advantage plan, then that's when to do it. If you're in original Medicare, go in October, December. And if you're in an Advantage plan and you want to change to a different Advantage plan, or if you want to change back to original Medicare, then you'll take your Advantage plan open season in January and March. Okay, we get this question all the time. Hey, I'm still working. I'm 65. I'm still working. I've got an employer health care plan. What do I do here? Here's the deal. TRICARE for Life, remember, is a Medicare supplement. If you don't have Medicare, you can't have the supplement. So if you don't sign up for Medicare at age 65, parts A and B, then that means you won't have TRICARE at age 65 because you didn't sign up for Medicare. So here's the game plan for if you're still working. You can have your employer plan if you're into that and you like your employer plan and you want to continue your employer plan and you're still working, then your employer plan will pay first. You can choose to have Medicare or not have Medicare. If you have Medicare, of course, you'll have TRICARE for Life behind it as the supplement. If you don't have Medicare, then you won't have TRICARE for Life as the supplement. So let's say you have Medicare and TRICARE for Life. Your employer plan will pay first. Your Medicare will pay second. Your TRICARE for Life supplement will always pay last. If you're retired, and let's say now you're not working, and as a result, your employer provided you a retired healthcare plan, and you continue to have this retiree healthcare plan. Then what happens is you'll sign up for Medicare, And as a result of Medicare A and B, you'll have TRICARE, but Medicare will pay first as a retiree, and that'll pay first. Your retiree employer plan would pay second, and TRICARE for Life always comes last. You're going to have a bit of a coordination issue here if you have 3 healthcare plans like that, but it's something to keep in mind as you go forward with all of these options that you have. So if you're still working, you can have your employer plan, you can have Medicare A and B, and you can have TRICARE, or you can just have your employer plan and you can put Medicare and TRICARE on hold until you quit working at some point. Or you can not have your employer plan and you can just have Medicare and TRICARE for life. It's up to you how you choose that. Once you're retired, and if you have an employer plan, a lot of folks say, why would I pay for Medicare A and B as a retired person and pay for my employer plan as a retiree? If you don't want to do that, then see if you can put your employer plan in suspension and then just suspend the plan. Don't pay for it, just have Medicare and TRICARE for life. And if you ever wanted to energize this suspended employer plan, you could always have it in your hip pocket. You could cancel the employer plan too, but then chances are you're not ever going to get it back. So we typically don't suggest having another plan. We hear a lot of complaints about TRICARE Prime and Select, but we don't hear that many complaints, hardly any at all, about TRICARE for Life, and it seems to cover everybody just fine. So we don't really see the need to pay extra premium costs for a third level of insurance. There tends to be coordination issues when you have another plan, and then you tend to have issues about filing claims with TRICARE for Life for reimbursement at that point. Plus, if you have that other drug plan out there, it cancels your TRICARE for Life home delivery, and then it will require you to file manual claims with the TRICARE pharmacy plan if you have some other drug plan besides TRICARE. So we usually don't talk about or have that other pharmacy plan either. Okay, what about when you're traveling? Medicare does not cover you when you're overseas. So what happens then is TRICARE for Life converts from being a Medicare supplement to TRICARE Select when you're traveling overseas. If you do that, make sure you coordinate this with TRICARE and all before you take off in the overseas area, and check with your embassy for any providers in the area. And in an emergency situation, you're going to always be covered anyhow, but these are things that you just probably want to have a heads up about. Also check with your traveler company or your agent, your traveling agent or whatever, to see if there's some sort of temporary overseas health plans that you might want to look into for additional coverage while you're overseas. Now, some of you, we get asked this all the time. Hey, I'm in TRICARE for Life, so I got Medicare, I got my TRICARE. Can I still be seen in the base hospital? Maybe. All the base hospital commanders have the approval authority over what retiree population they're going to see in their hospital based on their hospital staffing levels. So if you can be seen, then they will approve you to be seen in the base hospital as a TRICARE for Life person. If you are being seen in a military treatment facility on base and you're TRICARE for Life with Medicare, that's called TRICARE Plus. You're still TRICARE for Life, you still have A and B Medicare. It just means you've been able to get into the base hospital, and there's some paperwork you have to fill out with the base hospital that says that you have been approved to come to the base hospital even though you're TRICARE for Life. The other question we always get is about long-term care. No major medical plan, none, cover long-term care issues. And that goes for Medicare and TRICARE for Life. They're not long-term care policies. They don't cover long-term care issues. Now, when I say long-term care issues, I'm talking about issues that mean that you need assistance to be able to function in your life as you recover maybe from an illness or an injury, or maybe because there's some sort of dementia issue going on. But the idea is long-term care isn't considered a medical issue. It's considered usually a recovery or some sort of recuperative type situation, or one where you just can't take care of yourself. So it's more of a caretaker status, and those are not covered. The VA has some long-term care type programs, But in order to see if you qualify for the VA programs, you need to go visit your local Veterans Service office. Just Google search county Veterans Service office for your state, and you will come up with the local people, and go ask them about what VA programs exist for long-term care and whether or not you qualify. They're not automatic. The other thing is that you can always purchase long-term care insurance, and long-term care insurance, if you're going to do that, consider the MOA long-term care buying service, because we've got a pretty darn good situation for MOA members buying long-term care, because we are not affiliated with any particular company, and we have arrangements with a number of companies and all kinds of policies, not just your standard policies, but we have some hybrid products out there too that are pretty cosmic that you might want to check into. Just go online on moa.org, and you can look into the long-term care buyer service or call the member service center about it. Okay, if you're in the U.S. Family Health Care Plan, you may or may not be able to be in it as somebody in Medicare TRICARE for Life. If you are enrolled in the U.S. Family Health Care Plan prior to October 2012, then you can stay in the plan after you turn age 65, and the U.S. Family Health Care Plan can be your version of a TRICARE for Life by just staying in the plan. But if you were not enrolled in U.S. Family Health Care Plan prior to October 2012, you have to go on Medicare and TRICARE for Life. But the issue for all you people out there that are part of the U.S. Family Health Care Plan and you intend on staying in it even after you turn age 65 and beyond, if you ever get out of it for whatever reason, maybe you move, for whatever reason you decide to move out of the U.S. Family Health Care Plan program area, then at that point, if you have to jump into Medicare Parts A and B and be in TRICARE for Life after you get out, and it's after age 65 and you've missed the initial enrollment period for Medicare, you're going to be enrolling in Medicare A and B as a late enrollee, and then you're going to end up paying a pretty hefty premium penalty with Medicare. So that's something to consider about what your plans are of your U.S. Family Health Care Plan. Also, check with the U.S. Family Health Care Plan when you're traveling to make sure you understand what the traveling arrangements are when you're out of their region. Okay, for Medicare, here's the place to go to find Medicare doctors or facilities. Just like TRICARE, I mean, there's plenty of ways you can find doctors. I mean, all you really have to do is just call somebody up. You know, if you've got a referral from a family member or a friend or something, just call up the doctors and ask them if they take Medicare. And if they take Medicare, well, then that's automatic that they're going to take TRICARE for Life. So you're golden. The main thing with TRICARE for Life is the doctors, hospitals, and clinics, the TRICARE piece to it's invisible. You go in there, you show them your Medicare card, you're golden. Medicare takes care of billing the TRICARE piece, and so that's pretty much invisible to the doctors, hospitals, and clinics. Your only thing is, do they take Medicare? And if they do, you're golden. Okay, next thing here, and we're just about to wrap this up, and this is it here. TRICARE for Life is contracted with the DoD through the Wisconsin Physician Service. That's your insurer. And here's some contact information for them. And then we also have a book at MOA called Aging into Medicare. All you got to do is call the Member Service Center if you'd like a copy of this book that explains the whole process of aging into Medicare and what the transition's like and how it works. Anybody can order that book and you're good to go. I think that's pretty much it for us. Remember, as you go into this, we will post this webinar on the MOA website in a couple of weeks, and then everybody can either re-watch this, or you can always call up the Member Service Center here at MOA and we can answer questions that pop up. Thank you very much, folks, and let's see what we get to next. Here's Jim to wrap it up.
Thank you, Shane and Paul. What a great afternoon full of useful information to smooth a couple of life's major transitions out of military service and then again at 65 with the transition to Medicare and TRICARE for Life. We really appreciate you sharing your expertise and all you do for our MOA members and for the broader military community. The work you do truly exemplifies the MOA motto of never stop serving. As a reminder, please help us enhance our webinar productions by completing the short survey that you will see after this webinar concludes and offering us your feedback. I also want to highlight that if your family includes a rising undergraduate, we can always use some additional assistance financing college expenses. I invite you to explore the MOA Scholarship Fund at moa.org/loans. moa.org/loans. This fund has been in business for almost 71 years and awards about $9 million to 1,300 rising undergraduates every year. It's a wonderful program provided by the Military Officers Association of America. We appreciate each of you joining us today and look forward to assisting you with all of your major life decisions.
Okay, we're running out of our hour time. There was one comment. We had a TRICARE Overseas Program Global Quality Director send in a comment that he wanted us to pass to everybody. Shane, are you hearing me? Okay. He wanted us to make sure that everyone knows, for those overseas, that they will likely have to do what's called a pay and claim. Very few providers will file on your behalf overseas, and not that the TRICARE Overseas program will require them to do so. Also, if you require medical evacuation while overseas, you will likely have to pay up front and submit claims. EVACs are the only nearest center of medical excellence, not back to the US in most cases. If you require medical evacuation, contact International SOS, the Overseas Managed Care Support Contractor for assistance. Otherwise, you are subjected to much higher costs. So I wanted to pass that on. I think we can probably try to answer a couple questions that we don't think were covered by the program. Shane, if you want to go ahead and start, if you want to pick one.
Sorry, folks. There's so many questions out here. I'm looking to see what's out here that we can handle real quick. This one's a little different. What's the difference between TRICARE and the benefits? Well, TRICARE, any of the TRICARE programs, we're talking about major medical plans to pay for hospitalization, doctors. I'm sorry, folks. Here I am. Now we're good to go. I'm sorry. We got a question here about what's the difference between TRICARE and the benefits, and as a result, the TRICARE programs are major medical plans. They pay for hospitalization, doctors, medical procedures, things like that. The benefits plan, the FedBit plan, those are strictly dental and vision plans. So when you go to the dentist or when you go to your eye doctor for eyeglasses and contacts, things like that. So they're two totally different things. And usually major medical plans do not pay for you to go to the dentist, and they don't pay for you to go to your eye doctor. So that's a big difference between those plans. Let's see. Yeah. Then TRICARE for Life. Is there a way to avoid paying Part B? No, there's no way to avoid paying Part B. I mean, you have to have Medicare Parts A and B to have TRICARE. If you don't want in Medicare Part B, then you won't have TRICARE. And maybe you don't want Part B. Maybe you just want Part A, which is the free part. Well, not free because you paid through your payroll taxes all those decades. But the idea is if you don't have Medicare Parts B and you don't have then you don't have TRICARE for Life. I guess you got some other way of covering it. Maybe you're going to the VA. I don't know. Or maybe you've got some other health care plan through your employer. That might be it. What's the catastrophic cap? The catastrophic cap is the maximum amount of money that you would spend out of your own pocket in a given year for you or your family. Now, in the case of TRICARE Prime and TRICARE Select, the catastrophic cap is $3,000. And as a result, $3,000 is the max you're ever going to pay in TRICARE Prime and Select. Now, on the other hand, if you're in TRICARE for Life, then you're covered by Medicare Parts A and B. They're going to pick up all the parts of the bill that Medicare Part A and B would cover. Any residual part of the bill falls out to TRICARE for Life, and then TRICARE for Life is going to pick up the residual cost of the bill. So there's really no catastrophic cap in that particular position. Well, folks, I think that's about it. If you're still out there and you're still hearing me, I think we're about done. If you still had a question, we're going to get to the questions. We'll have to email you answers. We will not be able to handle them on this broadcast at this moment. So stand by for email answers on any questions we didn't get around to. You can always call here to MOA, to our customer service center at 800-234-6622, or Ben, B-E-N, info, I-N-F-O, beninfo at moa.org. Thank you very much for your participation today. Best wishes to all of y'all and your healthcare needs. Talk to you later.